Positive patient experience is essential in building patient loyalty for your practice, according to the latest from healthcare consulting firm Press Ganey. Are you engaging your patients effectively to maximize their experience? We're discussing ways you can ensure your patients have the right tools at their fingertips, literally, to enhance their experience and grow your practice on this episode of Putting Possibility into Practice, and it starts right now. I'm Joe Agostinelli, Social Media Manager at Greenway Health, and welcome to this episode of our podcast, Putting Possibility into Practice. Are your patients engaged in their care? Are you looking for ways to ensure the provider-patient relationship is a positive one at your practice? Today, I'm joined by Greenway's Associate Product Manager, Will Siegelin, to discuss how you can incorporate patient engagement tools into your practice or enhance the ones you are already using. And Will, I welcome you to the podcast. First time we've gotten together here on the podcast and talking a little patient engagement today.
Yeah, thanks for having me, Joe.
And Will, when we talk about patient engagement, first, what are we talking about and why is it so important to the health of one provider's practice?
Yeah, so I think one of the biggest things to look at when we talk about our patients and how they work within healthcare is patients are bad at being engaged in their own healthcare. They don't like going to the doctor's office. They kind of fear it. So there's a lot of tools we can put in place in terms of engaging those patients. And one way is stuff like a patient portal, giving them access to their health information a bit easier than what they're used to. So removing that need for them to call up a practice and get the information they need. And really, when you think about patient engagement as a whole, it's really about driving that better health outcome. An unengaged patient will let any issue they have compound upon itself until eventually they end up back in the hospital for an issue. Even for healthy patients, it's important for us to be able to see how they're trending throughout their life with their health. So when it comes down to patient engagement, if we can keep those patients active in their health care, it can really help kind of drive things forwards. And for me, really, when I think about it, I think back to the old days, back when I was a kid, and my dad has Crohn's disease. So he has to go in for an infusion every few months for his medicine. And he's awful at going to the doctors. And he has a pretty bad chronic condition. So we had this site that had a nurse who would constantly call to make sure he would show up and have that infusion. And to me, that was, back when I was younger, didn't really realize it, but my first real kind of initiation to a form of patient engagement, that patient outreach. And so now we have tools in place that can automate that. If that site had automated messaging that they could send out a phone call to my dad on a regular basis, we could have freed that person up for a face-to-face interaction within the practice, or to spend a little bit more time with someone who needs that longer explanation of maybe a previous visit and stuff. So really, when we look at kind of how we transform our practices, how we transform ourselves, how we grow as an industry, we need to make sure that the patients are the forefront of what we focus on. And we do in a lot of ways, but I still think that patients feel it's inconvenient. And that convenience factor in patient engagement is really what drives them back when they feel that they don't have to do a whole lot of work to get your attention or a whole lot of work to get the information they need. It builds this kind of trust through really non-active means. A lot of these are passive means that you're already doing this in your workflow to receive the health information and to push it out to the patient through a portal, let's say. Well, that doesn't really impact your day-to-day interaction with that patient, but it is still instilling a lot of trust when they know they can go to that portal and get that information.
And now when we talk about patient portal, I mean, it seems like everything you do now has a portal, whether it's your bank, or you want to pay bills online, or, any of your online accounts. With a patient portal, and we talk about the access, do patients have full access to this portal? Is it available basically wherever they are, smartphones, tablets, laptops?
Yeah, a big kind of concept behind patient engagement is that the way you engage your patient needs to be on their terms. So with things like patient portal, most of our interactions on the portal come through smartphones. So we have a responsive design for ours that if you log on through your phone, it's going to look a bit different, but scale correctly to that phone all the way up to a desktop. So the experience they have is going to be the same throughout. And one reason why we do that is because a big frustration we have as consumers is when someone changes something on us and it's not well explained. So with the patient portal, one of the features really is usability. We want people of all ages to be able to log into this portal and understand it in whichever device they want. Because if I tell a patient, this is only going to work on Internet Explorer on a desktop, nowadays that's not really going to mean anything to someone. They're going to go, great, I'm never going to interact with this then. I need it to be on my terms. So that's really a biggest thing with patient engagement, is the moment you try to force them into a specific kind of communication strategy or a specific place where they can get their information, you've effectively cut off a lot of the interest for your patient, and really are kind of doing them a disservice when it comes down to their healthcare. So when we talk about portals in general, it needs to be an all-in-one sort of solution for them, where they know they can go to it and meet all their needs. Think about, like what you were mentioning before, other industries use portals all the time. And the reason why we've moved to this, one big thing, people don't like talking to people anymore. It's a lot of people view it as inconvenient. I'm going to try to call. If I can't get a hold of you, I'm going to be frustrated. I'd rather be able to send a secure message over to my provider and not have to call them, or go onto my portal and schedule my own appointment instead of having to do a back and forth with someone where I feel like I'm losing time, and that frustration disengages me. And that's really what you look at it. You look at ways that you can ease that burden on the patient, which is really what a portal does. If I'm waiting for lab results and I get a message from my provider that all my results are normal, I want to be able to go to the portal and see my results. I might not understand what all of them mean, but as a patient, I want to be able to have access to that because I need that immediate access. It's what we expect nowadays. Technology grows so fast that we end up with this kind of concept where it's immediacy is the norm. And that's only really possible with a patient portal for our patients. If we started to do things going back to paper, requiring them to contact us for every little detail, then ultimately we have forced them to decide, I'm going to go somewhere else. I want to move to a provider that gives me convenience, because convenience is engaging. It's what really latches onto someone and lets them know, great, they care enough to invest in a solution for me, which I think is important for us to note. So one of my favorite things with patient portals personally is the ability to do secure messaging. It takes a while when you call someone to get the information you need. Instead, I can send that off in the morning and then check back later in the day when I have a response and have that interaction quickly on my time. And the moment you start to force things to not be on a patient's time, that frustration happens. They're not going to care as much. And we already struggle with people who view, I'm healthy enough, so I'm not going to be engaged in my healthcare. And really, these kind of technologies, as you start to adjust to them and adopt them and really use them, you'll realize software is not the only solution. Practice transformation needs to come in too. How you view the portal, how you use the portal, how you interact with patients on the portal. And then you can start to move into that kind of second tier of patient engagement, which is patient activation. A patient who's actively engaged in their healthcare, who's working with you on a bi-directional basis, not just you pushing information out to them, but them also pushing that information back to you and really working with you to improve those health outcomes, then becoming an active participant in their healthcare.
And you mentioned something there in regards to patient engagement with providers, secure messaging, and I was going to ask when we talked about the portal. I mean, if I'm sending, if a doctor's posting information, you talked about lab results. I mean, obviously your health information is going to be on this portal, all sorts of federal regulations and HIPAA. And how secure is the messaging and the data that's on the portal, for a patient and a provider?
Yeah, sure. So we use the industry standards in terms of encryption to make sure we don't have any sort of issues with the messages that are being sent back and forth. An important thing to note with internet traffic is HTTPS is a secure protocol for us to use, and it requires you to be on more recent encryptions for you to really be able to securely get that. So it works out well. Everything's encrypted that you send between. We don't store anything on our online app. Nothing's stored on the patient's device directly, because really we don't know what the patient's going to be doing with their device, so we can't really trust that they're going to be okay with they go to a site, something gets downloaded, now their information is breached because they have access to it through the person's device. So all of that is stored on our side, where we have, I can't even count how many steps in place to ensure that we don't have any sort of breach. So everything moves back and forth securely without any issue, and we cut out that concern of the patient's device as probably our biggest security loophole. So we keep everything on the EHR side and then on our secure database side in regards to patient logins and stuff like that, to make sure that everything stays safe.
And in regards to patient messaging, I mean, just on top of going back and forth with your provider, there's a number of ways to use messaging services, and you talked a little bit about appointment reminders, but what are some of the ways that providers can engage with patients, and maybe not the providers, but other staff members, in regards to messaging with patients?
Yeah, so I guess the first thing to kind of talk about when it comes to messaging is automation is key nowadays. The people who just want a quick message, fine with patient messaging, but we're always going to have those patients who need that, that special kind of engagement and more active engagement from your staff. So patient messaging is designed to free up those staff, allow them to have those kind of more active communications with things like appointment reminders. But then you start to dive a bit deeper into that, and we start to look at things like recall notices. So getting that patient back in the office to follow up on their health. Those kind of automated kind of health continuum pieces ensure the fact that the site can work within their EHR and then have another service focused on that communication and contact. So if you're using recalls within the EHR system, with patient messaging, it can kind of latch onto that event and send a reminder out to a patient to let them know, hey, it's, in the next 30 days you're due for your annual wellness check. Please contact the practice and schedule it, or please go to the portal and schedule it, whichever works best for your team. So with patient messaging, it's about efficiency. It's about allowing you to reach out to everyone and get the patient back in the office. It's easy to miss someone. And you go through and you're calling this list of people, you're going to sometimes get dead air. And the reason why you get that dead air when you just call is because you're engaging them through a singular method, which is dangerous nowadays in terms of kind of your practice health. With messaging, most messaging platforms like Greenway Patient messaging allow you to integrate, or allow you to kind of contact people through multiple methods. So through text, email, and voice. New methods coming later on, as we keep building. But the patient gets to decide their preferred communication. Best example I have would be, if I get a letter from someone that I owe a bill, I might not think about it. Might just grab my mail, put it on my table, and not look at it. But my phone company texts me saying, hey, you have a bill coming up in 14 days. It's set up for auto pay. It's going to go through. I'm like, great. I saw that text because I checked my phone. I don't always check paper mail or through email. Your patients are going to have their own preferred communication method just like you do. So when you go through and you just have the ability to call because you're doing it kind of the old-fashioned way, where you have someone on your staff who's sending out those reminders to make sure people know to come in, you're both limiting your outreach to your patients, you're limiting your staff's time, and it's just inconvenient for both parties, which is something that we try to fix, right? We try to find these efficiencies. That way the individuals who need the more intensive kind of care can get that, and those who just need to not forget that they have an appointment in 7 days can get that message. Another thing about patient engagement and building trust, like we were talking about earlier, is ensuring you have ways to reach out to patients when something comes up. You have your practice closed and you can't let your patients know. It might be a beautiful day outside, but you might have a power issue. Well, you can't see anyone that day, but people are still going to come in. So the good thing with a lot of these engagement platforms, with patient engagement, patient messaging, it's cloud-based. It's not requiring you to have your EHR kind of there up and running. We have the events in our system to allow us to use it. And we're updating constantly. So you can just go from your phone even, log into your patient messaging portal, and send an appointment broadcast out to patients who might have an appointment that day saying, hey, we're closed today. We're sorry for the inconvenience. And when you look at it, you're reaching out to them in the way that they're most likely to check because they chose their own preferred communication. So you calling someone to say, hey, your appointment's not going to happen. For someone who checks their phone, answers calls from a number that they might not know, which is rare nowadays, great. But that person who needed a text because they can't check their phone while they're working, or that person who works on the computer all day and would prefer email because they just get a notification on their desktop while they're working, those people won't get that call. And they're going to show up to your practice, they're going to be upset, and really lose a little bit of faith in the practice. So that trust, kind of building that trust, is another way of engagement with your patients. Because if they trust you on a kind of fundamental business level as well as a healthcare level, that's when you get that kind of patient stickiness, when they stay around, when they want to stay with you, and they can say, I really trust this practice because I've never shown up and they were closed because no one bothered to tell me. Which is one of those features in patient messaging that we don't often look at with engagement when we kind of start to talk about trust that the patient has for you. Any way you can make their lives more convenient, they're more likely to want to stay with you in a business sense, and also from a healthcare sense. They're going to know that you care the most about them and their needs and their convenience, and that's going to make them want to come back to you, which builds that continuation in terms of you knowing who they are, you knowing their health, and you being able to drive a better health outcome because they're not a transient patient going to urgent cares and different primary care providers over the years.
And you discussed Greenway Patient. If a provider maybe already has it and is not utilizing it to its fullest capabilities, or if somebody is looking to enhance their engagement with their patients and does not yet have it, what are some of the additional features and highlights of Greenway Patient, and how does it work into the holistic patient engagement plan for a provider and their practice?
Yeah, sure. So when we look at Greenway Patient in that sense, we have two core platforms we use, and one is our portal and one is messaging. So with the portal, you can have that additional personal touch with the patient. So you're able to have those bidirectional communications back and forth with the patient. Additionally, you have kind of their health information at their fingertips, which is a huge thing. It's really flexible for your patient. It allows them to access their information when they need to, when it's convenient for them. And probably the biggest thing to note right now, if you're scared about having to take on patient engagement, is that portal and messaging are relatively workflow neutral. When you sign that encounter, it's pushing that visit out to the patient portal. When you schedule that patient for that appointment, your setup that you've done for your appointment reminders sees that new event and gets everything ready to where it can engage them with the messaging, how you set it up. So when we kind of look at the way you can engage with the patients through these platforms, Greenway Patient Messaging, it's automated. So if you're looking to really utilize messaging, over the past year, we've done a lot to really bring that forward into self-service to give our practices more control over the messages they create. Our old system had the same, it worked all the same, just we would do the editing of the messages, which wasn't convenient. So for those of you out there who have messaging right now, log in to myhealthrecord.com, go over to the notices section and take a look at your current setup. See if it still meets what you expect it to meet. You might not have looked at them since you were set up, let's say a year ago, and some things have changed, or you decided, hey, I actually want to send out one extra message. So we send out, let's say, 7 days before. I also want to send one out 2 days before. And add on a real-time message if that wasn't present before. That way when I schedule the appointment, it sends out a message to the patients where they have that reminder instantly. So that would be my first recommendation if you currently have the platform. If you don't have the platform, start to think about how this will free up your time. It can handle a bunch of things like no-show messages even, so you don't have to worry about contacting those patients about missing their appointments. And even little things like birthday messages, which are always nice to get. It keeps you top of mind for that patient when they go, oh, cool, neat, thank you. Again, kind of going back to it, check what your patients prefer communication-wise. It's really important that you're asking that question upon checkout or even check-in whenever it's best for your practice, that you're asking those questions of how do you want to be engaged? How would you like to receive messages from us? Do you prefer a phone call? Do you prefer a text, an email? And know what that patient's looking for. If you don't know what they're looking for, then you're not going to see a reduction in no-shows because you're dictating how they should be communicated with, which nowadays patients expect. They're consumers. They expect to be catered to and to be helped out and engaged the way that they prefer. And the other thing I would really like to kind of point out with the portal side is there's a lot you can do to adopt with that system to help your practice out. Medication refills are possible through there. A new feature that just recently came out for our Prime Suite customers and will be coming out soon for Entergy is direct scheduling. So a patient can go in, see your provider availability, and just schedule directly onto your schedule, or just see that availability and select that time and send a task over for someone at your front office to add them to the schedule. It's deeply customizable, and so for those of you who have the system, take a look at it, take a lay of the land, understand what your setup is. You might not have looked at it for a while, and then think if that really fits your engagement strategy, and learn about the features you're not familiar with to be able to better interact with your patients. Patient engagement is far more than what software could possibly do. Patient engagement really comes down to being something that is adopted by clinical staff and office staff to help your patient just come out healthier in the end. And these systems allowing you to be more efficient as a team, allowing you to get your patients what they need when they need it, is integral in that, because it allows you to focus where you need to focus without having to worry, did that patient get what they need? Because you have a system in place that knows, yes, they have what they need. Now let's focus on how we can improve upon their health.
Well, I want to thank Associate Product Manager Will Siegelin, who lots of great information about patient engagement and how if you already have the patient portal and Greenway Patient, maybe you're not using to its fullest capabilities. Hopefully you learned a thing or two from Will. And if you are considering adding a patient portal or to learn more about the features of Greenway Patient and our patient engagement resources and tools, I invite you to visit our website at www.greenwayhealth.com. Will, thanks for joining me. Very informative.
Thanks for having me.
Once again, that is Will Siegelin. He's the Associate Product Manager here at Greenway Health as we discuss patient engagement and what you can do to enhance the relationships that you have with your patients in your practice. And as I mentioned, for more information, please visit our website at www.greenwayhealth.com. I'm Joe Augustinelli, the Social Media Manager at Greenway Health, and this has been another episode of our podcast, Putting Possibility into Practice. We hope that you enjoyed today's podcast episode, and if you did, please subscribe to our podcast on your platform of choice. Thanks again for listening.